Hey guys, what's up? My name is Mel. I'm your friendly pharmacist here on YouTube, and today we're going to be talking all things prescription labels. These can be really confusing, and most of the time, patients don't even look at them. So I'm going to show you how to read these labels so that you can double check them at home really quick, whether it's for yourself or someone in your household or maybe for an elderly grandparent. But we can make sure that these are right, and then if something stands out and doesn't look right, we can call and make sure it's okay. Medication errors are on the rise. Pharmacists are overworked. They're understaffed. There is a huge shortage of pharmacists in the retail setting today. And so they're more likely to make errors. This is one way that you can safeguard and gatekeep your home and make sure everything that comes in is safe and effective. Let's address the elephant in the room. I'm in my kids' playroom today. We got Barbie back here. We got some math things. We got some coloring things. Y'all, whatever goes, goes, right? Let's dive in. So when you go to the doctor and they write you a prescription, you get it on that little piece of paper, right? Well, that's kind of old school. More likely these days, they fax it in or they send it in electronically. Basically what comes back on your box is something that looks like this, right? I've tried to black out all the stuff that you don't need to know. And yes, I have ivermectin. For the past 2 years, I have had ivermectin. I've helped others get ivermectin. Because I have seen in the people that I've known how this has helped tremendously. I digress. Up at the top, y'all, you're gonna see specialty pharmacy. So this is gonna always be the name of your pharmacy. If this is wrong, then we have a real problem. That part you probably don't need to check. And then there's normally the address of the pharmacy right below. That's easy peasy, not a whole lot to worry about there. But something to really look for, usually right next to that name, is their phone number and their fax number. So good to have on hand, because as we go through the rest, if something doesn't look right or it doesn't match what the doctor told you or you don't understand what it is, call that number. That is what pharmacists are for. Those were my favorite phone calls to take, were questions from patients who either maybe thought something was wrong or thought they were having a side effect or just wanted to ask questions. That is why pharmacists are there. That is why they go to school. That is why they get paid well, is to inform you and help you understand what's going on. All right, next up, you're gonna see the letters RX. This is going to be your RX number. So this is going to be the part where you can call in automatically and fill in a refill. So that's all that is, not super important. But what I do like to always double check is the fill date. So this is going to be really important for you, okay? The fill date is going to tell you the day that they filled that prescription. It's not necessarily going to be the same date the doctor wrote it, but it's going to be the date they filled it. This will really come into play when we start to talk about controlled substances, okay? Because the pharmacist is going to look at, well, when was this filled and are you trying to refill it too early? And then they may ask you questions. That is their duty, to ask questions to make sure that something isn't off that they need to address with the doctor. And you're probably going to see your address, your name, and your phone number. You want to check this. Make sure your name is right. That is so important. You could run into insurance problems. You could run into filling errors. So make sure your name is absolutely perfect. And then also the phone number, because if the pharmacy needs to call you about something, you want to make sure they can get a hold of you. Next is probably the most important part. Usually down here at the bottom, you're going to see drug name and drug dosage, okay? That's the dosage, is usually the number followed by a milligram, okay? So the name is ivermectin, 3 milligram oral tablet. So pay attention to this. This could say oral tablet, which is something you're gonna take orally. This could be a patch, right? This could be a suppository, which is gonna be used rectally. It could be a buccal or a lozenge, so that's something you put in your cheek. So make sure of what that says, and if you don't understand, call the pharmacist. Or if the doctor said, okay, this is gonna be a suppository, and then it says oral tablet, you probably wanna check with the pharmacist. Always go to the pharmacist first, not just because I'm a pharmacist, but you're gonna be able to reach them a lot easier than you're gonna reach the doctor. And this is their specialty, medication. So use them. Okay, here's the other really important part I want you to look at. It's the directions. The doctor should be telling you how you're gonna take this, how often you're gonna take this, when you go home. It should usually be on a piece of paper as well, so that when you get this from your pharmacist, you can be like a triple check. So when the pharmacist gets the prescription from your doctor, they take it and then they look at the label after the technician types it up. So they're gonna compare what the doctor gave to what the technician typed up here, and they're gonna make sure it matches. That's one of their big duties, right? They're gonna make sure all these things match so that you're getting what you're supposed to get when you're supposed to get it. So if you get this and you're like, I don't think I remember that this way, or this doesn't match what the doctor or the nurse told me, call the pharmacy. you're not bothering them. That's their job. And they should not be annoyed by that, okay? You're just making sure that you're getting the right medication and you're taking it properly. There is no shame in you double checking that. So that's on that. Then of course, this is gonna say down here, sorry, the doctor who wrote the prescription, you're gonna have, this is a really important part. So after I would say, making sure your phone number's right, making sure the dosage, the name of the drug, and the directions are right, I would say the next most important thing is the quantity and the refills. Quantity of 40, okay? And then refills remaining. But you wanna look at the quantity that it was written for. Does it match what the doctor told you? Like, hey, I'm sending you home with a 30-day supply, so that should last you 30 days. Well, if you're taking something 3 times a day, you would need 90. So if the pharmacist only gave you 30, you're gonna run out in 10 days and need a refill. And insurance is gonna be like, what? This doesn't make sense. Make sure you check that as well. Make sure it makes sense. Let's look at this. Let's do an example. 4 tablets by mouth as 1 dose daily for 5 days. It runs off the side. Yeah, usually it's for 5 days, okay? So if I'm taking 4 daily for 5 days, I would need 20, okay? So I need to have at least 20. And then I've got 3 refills that I can use by, pay attention to that as well. I need to use those refills by 8 whatever, okay? So that's the date that you have to use the refills up by, or else they're lost, okay? We're gonna have to call the doctor and get refills. Get mad at your pharmacist if you call and they're like, the date's passed, like I can't just refill that, we need to put in a request to the doctor. Here in Indiana, prescriptions expire in a year, so like I would have a year to use this. A controlled substance, those tend to differ. For the most part, a year prescriptions expire, so you're gonna have to use up the refills by that. All right, y'all, that is it on prescription labels. I hope this was super helpful. If this is something that was too basic for you, then maybe it's something to share with a friend, a family member. Maybe they are taking lots of medications and they have never even thought about this. I really want to encourage you to be the gatekeeper of your home and also of your family and friends' homes, and share this information with them so that they can triple check what is coming into their home when it's time to use it. If you have any questions, leave them in the comments below. Hit the like button if this was helpful, or maybe if you think it would be helpful for a friend, and please tell them to subscribe, and you subscribe as well. I cannot talk. And goodbye from my kids' playroom. Until next time, bye y'all.